Send me out some energy, you Sparmanites and you listeners, and I'll send it right back to you, even stronger. Good morning. It's 9 o'clock, and every Saturday you tune into Living, and we've been dealing with the Heart 1 last week, and it's going to be Heart 2 today. I'll give you some little small things that you need to know about this atherosclerotic process of plaque building and so forth within the arteries. It's the number one killer. The number one cause of death in the world is cardiovascular disease, whether it's from stroke, heart attack, or blood vessel problems. So it makes sense for you to know, about it and what you can do to prevent this stuff. We had some facts out there for you last week, and as a matter of fact, let me say hi to some of my diehard listeners out there. Mary and David from the airport. You guys see me every time I pass through there, and you try to tell me to take my shoe off and everything off. Love you. So, good morning to you, and I know you're tuning every Saturday. So all you guys out there, and the ones that don't remember, and the ones who are hidden in the corners, are you guys there in the ZRs? Let's turn it up a little, not too loud. Let the people hear some health facts, and we'll talk about some health tips when I come back. Lively up yourself, and living and love, and all of those nice things. I'll be back in a minute. Health tips for today: avocado. You eat that? You know what avocado is. I like it a lot. But some health tips: eating avocados for dry skin. Incorporate more of avocados actually into your diet. They're rich in unsaturated fat. That's the good fat. Remember we talked last week about unsaturated fat is bad for you and trans fat is bad for you, but unsaturated fat is good. And vitamin E is present also in avocado, both of which promote healthy skin. So try them on salads and sandwiches and even in smoothies. Avocado, vitamin E, good for you. And why don't we go on to things like small talk? You say gossip is bad, but not gossip, just small talk, It stimulates the brain, actually. They say that if you engage in casual conversation with others, may help you keep you sharp as doing word puzzle, according to some studies. Just 10 minutes of daily chatter appears to improve mental function and preserve memory. So don't be aloof. Sit down and 10 minutes a day, speak something healthy with someone. It helps you. Small talk. And then we go on to primrose oil. You guys know that, especially the ladies. If you've ruled out other causes of hair loss, let's say you're losing hair and you don't know why, and they're breaking and all these type of things, such as stress. Stress does that to you, or overuse of hair care products and you're losing your hair, and certain medications also. And you may have certain type of diseases like hypothyroidism, or thyroid problems, where you lose hair. Consider supplementing with the evening primrose oil. It's a good source of linolenic acid, which is an essential fatty acid that's needed for hair growth, and it's hard to get from your diet. So experts recommend taking 500 milligrams twice a day. And by 8 weeks or so, you'll see some results. So you having ladies out there, your hair is breaking, whether it's whatever cause, illness, stress, medications, or you're losing hair. Try that primrose oil, 500 milligrams twice a day, and in 8 weeks you should have some good results. Those are tidbits in our health tips for today: avocado, vitamin E, and monounsaturated fats. And then we talk about small talk a little bit, 10 minutes every day, and then we talk about primrose oil, which is good for your hair, breaking hair. Yeah. This guy by the name of Charles Wright, nice guy, I saw him perform actually. Yes. He made one big hit. But His lyrics is what get me. Listen to what I say here. Just try to listen to this. I was, by the way, it's 9:07 VOB 92.9, guys. Saturday mornings, every Saturday 9 to 9:30. You're with the doc, and the doc sets you right and puts you in the path. We want to give you 30 more years to your life. So I don't care how old you are. We're gonna add. The younger you are, you get more years. But even if you're 17, you start modifying your diet with these tidbits I give you every Saturday morning. You'll still live longer. So jump on the train and let's ride. Listen to this little piece of lyrics here from Charles Wright. It's not what you do. Oh, let's go back. It's not what you look like when you're doing what you're doing. It's what you're doing when you're doing what you look like what you do. You got that? You just express yourself. A lot of guys, Ice Cube and they got hip hop guys that replace, and they do some revised version of jazz. Express yourself, guys, and I'll be right back. It's not what you look like when you're doing what you're doing. It's what you're doing when you're doing what you look like you're doing. That's just right, guys. And yeah, express yourself there. That song, man, it gets deep down in you. And they say when a song enters the brain, man, you can't get it out. So we're talking about heart, guys, and we're talking about heart too. And let me tell you about the whole atherosclerotic process. You got the arteries that are leaving, and this is the whole vascular network we're talking about, and why you don't have a lot of plaque formation in the veins. It's because the veins, as a matter of fact, you have more clot forming there because it's a lot of slow stuff going on there, and it moves very slowly. The pressure is very, very low in that system. So most times you're predisposed to clot in your brains, but in the veins, but in the arteries, where a lot of activities happening, a lot of contractile tissue, and it's high pressured, and everything is happening in the fast lane. So look at it like that: arteries, fast lane, and the veins, a slow moving vehicle. So what happens normally, because of all this stuff going on, nitrous oxide production and angiotensin II release and all these things in the endothelial cells, which are the inside of the arteries, a lot of activity. So if you get those walls rough, what makes the walls rough in the arteries? I think you have high risk for heart disease and stuff. Things like high blood pressure, high cholesterol, and diabetes, and smoking, and those type of things makes it rough. In other words, it makes the inside of the artery, the endothelial cells, or the intima, very unstable, and there's a balance problem going on. So let's see what happens. Now, remember, we talk about heart attacks. 1/3 of those people don't make it to the hospital. 1/3. And here in this country, how about 80% don't survive? And I'm not telling you something I'm trying to summate or something I'm trying to think out. I am giving you core facts. 2009 registry. 80% of the people get heart attacks that don't make it, guys. So if the national average is 30%, so you get chest pains, man, you go to the doctor, okay? Especially if you have risk factors for heart disease. This thing is serious. And it's not the heart attack of itself that takes you to the other side. It's the fast rhythm you go into. You see, when the blockage occurs, what it does, it causes an arrhythmia, ventricular fibrillation. And this fast heart ventricle beating at 500 beats per minute, that's not sustainable with life, and you die. So that is why early intervention, the guy can shock you and do stuff like that and bring you back. So you get chest pains, you got those risk factors: age, you're male older than 45, or you're female older than 55, or you got anybody in your family, close family members with heart disease history, you at risk: smoking, diabetes, hyperlipidemia, sedentary lifestyle, obesity, and all of these things, lipoprotein A problems. Those people are at risk. So And the more you have is the higher your likelihood. So we're talking about plaque, and I want to take you down to the plaque level, the cell level today. You're learning stuff here, huh? And as you learn, you'll be better patients and better and healthier people because you understand what's going on. So when you have all more risk factors you have, I said, the inside get rough. That's the endothelial cells, the inner lining of your arteries. So you have things like the LDL, which is the bad cholesterol, and the good cholesterol, the HDL. You want the HDL, the good cholesterol, to be high and the LDL to be low. The good cholesterol right now, HDL, takes it takes the plaque from the arteries to the liver and destroys it. The bad one, the LDL, takes it from the liver and put it right there. So you see, I told you, life is a balance of forces. So you want higher HDL and lower LDL. But these things are flowing. They're good. You need them. If you don't have cholesterol in your body, what do you think make up the cell wall? The walls of your cell are made with cholesterol. So you need this stuff. It's like I say, lots of things are good for you, but too much of it is bad for you. So LDL, HDL, the red blood cells, there's something called the monocytes. These cells fight any type of foreign stuff, and sometimes it fights its own cells within your body. And platelets, they're circulating in the normal arteries. When you have injury or a rough inside of that wall, what do you think happens? The LDL, the bad boy, goes right in there into the intima, right onto the top layer, okay, of the inside of the cell. Now, when it gets in there, it gets oxidized. You remember I talked about oxidation? Now it makes sense to you. I told you about antioxidants, man. Listen to this stuff. Write it down and check it out on the net. This is real nice stuff that you don't hear every day. Oxidation. That oxidation process here is terrible for your body. Remember we talk about free radicals? The guys that goes into your cells and destroy them and try to grab the extra electrons. Yes, by now you know the stuff because I've been telling you about it. Electrons and all these things. Free radicals is bad. It kills you. It kills the cells. An early cell death, an early death of people, period. That is why things with antioxidant properties, we talk about omega-3, 6, 9. We talk about all those type of things like vitamin E and things that are good for you, fish and stuff, that are antioxidants. They pretty much will stop the process of cell death caused by free radicals. So oxidation, man. Oxidation, the process is not good in some of these cases, like here. So the LDL is oxidized in the intimal layer of your inner walls of your artery. Now listen, stay with me, guys. I'm taking you right down to the river. You understand this stuff? And then they're changed. These monocytes now from the blood cells comes in also and follows them. And the monocytes in there are changed to macrophages, which is a bigger, stronger type of eating cells. Leukocytes type of cells, you know. And then, so the monocytes eats the LDL. It grabs on it, follows the LDL in the inner lining of the wall, grabs onto it, and eats it, and then becomes something called foam cells. You don't have to remember all the names, but you understand what's going on. LDL come in the rough arteries, which is caused by a lot of risk factors and so forth. The monocytes come and grab it, forms macrophages, and then the macrophages now forms foam cells, and these foam cells in that inner lining of the endothelial cell get layered. That's the plaque right there. Layer upon layer. And the more you don't control your sugar, the more you keep your pressure high, the more you smoke and all those things, all the risk factors, you don't exercise, guess what happens? More and more of LDL comes in there, and you have this plaque formation. That's the start of the heart attack process. And I can't take a call today, but next week I'll take calls. But I want to teach you today so you can get the facts straight. So we talk about the whole process now, and now as the age, some people more, it'll form quicker than some people. So the more risk factors, is the faster this thing is going to happen. So we're at a stage where we have plaque formation, and I'll come right back as we talk about Coldplay and In My Place, and I'll come back and finish up this thing for you. So stay with me, and I'll be right back. Yeah, in my place I was lost and I'm found now. That's Coldplay, guys. So, let me finish up. Next week, you're gonna get ready and sit down and ask me whatever questions you want. Next week is, we're gonna talk about, I'll give you that program. You can ask me whatever question you want. We can talk about heart or anything else. So, we talked about the plaque. Now, the plaque, as it grows, it gets bigger and bigger, and then eventually it limits the blood flow to the organ that you need, whether it's which part of the heart it is, or whether it's the brain, which part of the brain, or the kidneys. Once something happened like stress or anything that would start the process, it cracks, that plaque becomes unstable, it cracks, exposes the inside, and then a blood clot forms right there. That's the heart attack. That's the stroke. That's the renal infarct or kidney damage. That's the occlusion of your artery to your leg where you lose your leg. That's the process we're talking about, guys. So, to prevent that, that is why the doctors advocate. Watch your cholesterol, exercise, keep your sugar down, keep your pressure down, stay away from the salt, minimize the red meat that you eat. All of these things, it will slow the process down, right? Now you understand what we're talking about. So, what do you do if you have heart disease? Yes, that baby aspirin. That's if it used to be. I remember I said that a few months ago. An apple a day? No, I changed that. An aspirin a day keeps the doctor away. You listen and you wonder, right? Yes, there's nothing that will save your life and keep you living longer than taking a baby aspirin. What the baby aspirin does, it prevents the clot from forming on that unstable plaque. So even if you're having chest pains, go for an aspirin. Before you call the doctor, take an aspirin. It works. It works. So we'll talk some more about that. And if you can't take aspirin, there's something called Plavix you can take. That doesn't, if it burns your stomach, or of course you have ulcer in your stomach or whatever, you can take Plavix. You know, guys, it's nice being with you every Saturday, you know, to warm your heart and to cheer you up. And you're depressed and you're feeling down, I can talk and I can make you feel happy and bring a smile on your face. Yes, that's what I'm here for. Half an hour. Spicy, short, what? To the point. So, www.thesparman.com and dr.sparman@thesparmanclinic.com, and these are ways you can just send in your voice and tell us what you want to hear, where you want us to go with this program. So, if you're having a bad day, just remember that love and music make the world go wrong. I will see you guys next week. Daniel Powter. Bad day and bye-bye.
Them boys on Barbados.